My name is Sarah Drury, and this is going to be my part of our project presentation. My partner and I have put together a crossword puzzle for you to complete while listening to this presentation, and then at the end of her presentation that she sends will be the key for you to see how you did. Okay, here we go. This is all about Tay Sachs disease, and let's get started. So first of all, we're going to start off with a description. Tay Sachs is a disease that is inherited from parents that only shows up with symptoms if the child inherits the gene from both of their parents. So both of their parents must have the gene present in them for the child to get it, possibly. The only way to get it is if the child has both genes from both parents. So this gene, it destroys neurons pictured on the right in the brain and spinal cord. I will explain in a little bit how this happens more in detail, but this disease becomes apparent and symptoms start showing at only 6 months of age, and this is where their muscles start to weaken. Most children affected only live into their early childhood, unfortunately, because their body cannot support what it is being put through anymore. However, if symptoms do not appear until teen years or adulthood, these cases are not quite as severe, and these patients might live a long life. So now we'll move into the signs and symptoms, and as you can see, we have a quote-unquote normal child cases on the left-hand side. These are their symptoms, and then on the right-hand side, we will have the mild adult cases that I just mentioned, which are the ones that only experience symptoms later in life, not in childhood. So some symptoms that children experience include a loss of motor skills, such as sitting up and crawling. They startle very easy to loud noises. They may experience seizures, unfortunately, vision and hearing loss, possible paralysis, and cherry red spot in the eye, which is a red area at the center of the macula surrounding the retinal opacification, which is the accumulation of materials in ganglion cells in certain disorders, such as this one. So now in mild adult cases, the ones that don't show up until later in life, in mild adult cases that don't experience symptoms until a later age, they can experience muscle weakness, loss of coordination, speech problems such as a stutter, and then some mental illnesses. So as you can see, these symptoms are not quite as severe as the children who experience them in their early years of life. They only experience muscle weakness, which can still lead to very bad things, but maybe not quite as severe as losing your life at 1 or 2 years old. So loss of coordination may be stumbling, not being able to walk straight, speech problems like a stutter, maybe even a lisp, and then mental illnesses. So Tay Sachs disease is caused by an absence of an enzyme that is responsible for helping the body break down fatty substances called gangliosides. In people who do not have this gene, we have this enzyme that is able to break down the fatty substances in our body and in our brain. So the gene responsible for this disease is on chromosome 15, and that codes for enzyme hex A, which is hexosaminidase. In the picture on this slide, you can see where on the chromosome the gene is located in the patients who have it. The gene is passed down from parents to their children, like I said before, and affects the child if both genes are passed down. So as you can see in this picture right here, on the left-hand side, you can see 5P and then some numbers, and then on the right, you can see 5Q and then some numbers. So the 5P on the left-hand side is the shorter end of the chromosome. So this whole entire thing is a chromosome, but it is split into two sides, the shorter arm and then the longer arm. On the right-hand side with the 5Q, this is the longer side of the chromosome, and then the banding that you see is pretty much what scientists and scientists in labs see when they dye a chromosome to make it a little bit easier to identify exactly where the gene is located. So this gene would be located on a dark band for them, and it is between 5Q 12.3 and 5Q 13.2. Okay. So effects on the brain. So the real problem is that the gangliosides are not being broken down, and that causes a buildup, leading to toxic levels in the brain since they are not being broken down. This ultimately affects the function of the neurons in the brain and spinal cord and leads to the loss of muscle control, weakening of muscles, paralysis if very severe, blindness, and then ultimately death. In the picture on this slide is shown a patient affected by the disease, and we can see how it has affected their brain. On the top two pictures that you see is a normal brain, and on the bottom will be a diseased brain. On the left-hand side of the top and the bottom is both patients at 14 months, and then on the right-hand side is 4 years and 5 months. So you can see a very obvious difference by looking at it, whether you know what you're looking at or not. With the normal brain on top, you can see how it's supposed to look, and then comparing it to a quote-unquote diseased brain, you can definitely see the difference. So loss of eyesight is possible if the cells in the eyes or optic nerves are affected. So if the fatty substances build up on the optic nerve, this can obviously sever it or just damage it too much to where the patient is not able to see anymore, and this is very unfortunate. Okay, so now the diagnosis. To diagnose and confirm a child has the disease, a doctor will do a physical examination first to see if there's anything physically wrong with the patient. He or she is going to ask the child's symptoms and ask the parents if they are aware of any hereditary disorders in their family. So if the parents are aware of anything at all, not just Tay Sachs, if they're aware of any sort of diseases that their parents may have, their grandparents, anything that seems to be repetitive in their family history with diseases. So after the physical examination and questions are asked, a blood test is ordered, and then that will check for an enzyme called hexosaminidase, which we talked about before, which I mentioned before. Hexosaminidase is important in the metabolism of gangliosides, which are the sides which are those fatty substances, and an abnormal accumulation on neurons causing damage. So in a patient with Tay Sachs, their hexosaminidase enzyme levels will be very low or absent completely. So on this picture, you can see on the right-hand side are the hex-A levels in blood. At the very top is going to be a normal range, which is 100% hex-A, and a patient who does not have the gene on their chromosomes. And then if you go a little bit farther down, you'll see the inconclusive results, which is right about in the middle. The carrier range, which is a little bit lower, which means that the patient has the gene within them, but they may not express it themselves. They may not have symptoms themselves, but that does mean that they have a possibility of passing it down to their children. And then at the very bottom, you can see baby affected with TSD, which stands for Tay Sachs Disease. And this is going to be the people who have both genes from their parents, experience symptoms, or maybe not, and then they are going to have a 0% hex-A level because they will not have the enzyme to break down the gangliosides. So management and controlling the symptoms. So as of right now, there is no cure for Tay Sachs, but there are some medications that doctors have found that can be used to control some symptoms, only some symptoms. One medication that has been proved useful are anti-seizure medications if this is something that a patient has to deal with. This is a great thing for patients because seizures can cause brain damage if there are too many seizures and if they are suffering. So obviously, almost anybody knows that if there are too many seizures, this can damage the brain, and it can lead to the patient being worse off than they were before they even started all of this medication. So children that are at a high risk for lung infections do have the option to use chest physiotherapy or CPT to remove mucus from the lungs and make it easier or less painful for the patient to breathe. If there is moisture or mucus in the lungs, this can cause many illnesses or pain to the patient if it is not taken under control very quickly. Feeding tubes may be necessary if a patient cannot swallow on their own if those muscles are weakened. So if the throat muscles or mouth muscles are weakened, they may not be able to chew on their own and they may not be able to swallow on their own, which can become a problem because everybody needs to eat. So a feeding tube can be placed into the stomach directly, or into the throat. So physical therapy and management of muscles is one very important part of keeping muscles moving and keeping them from getting stiff. If muscles are not used and if a child is confined to a wheelchair, this causes muscles to deteriorate very quickly, and it is hard to get them back to normal again. So physical therapy keeps those muscles active and allows the patient to move their muscles despite the lack of control that they may have. So as you can see in the picture right here, this is going to be a child who not necessarily has Tay Sachs, but something that requires them to need physical therapy. And you can see that she is being walked on a treadmill while being held up so that she is not using every single one of her muscles that can be strained because she can't feel it, or she may not be able to feel the pain. So this physical therapist is moving her legs for her, it looks like, and this is obviously very important to keep up with the muscles so that they do not completely deteriorate. I do know that this is very important, physical therapy, firsthand, because I have seen my mother's muscles deteriorate since she was confined to a wheelchair in 2007 after a very serious accident, and she lost function in her legs. She was paralyzed from the waist down, and ever since she has not been able to use those muscles, and unfortunately was not offered what some children may be offered today. If she was, she might have bigger muscles right now, but she was not offered physical therapy, so she did not get to keep moving, unfortunately. This ultimately caused her to get bed sores and pressure wounds, which we obviously want to keep children away from and prevent them from getting these, because children might not be able to fight infections or fight this problem as easily as adults with more built up immunity systems. So if offered the opportunity, I really hope that these children get the opportunity to use to keep their bodies moving as long as possible and keep them from being confined to a wheelchair for the rest of their lives. Emotional support and therapy can be offered to the family of these patients or to the patients themselves if they would like that. This can be a very hard time on the family because they are going through a lot, and this is a lot of information to hear and deal with, especially in a young child that should not have to live their lives in pain or misery. So this is another slide showing a child doing physical therapy with a physical therapist. As we can see, he is bouncing on a trampoline, which keeps his muscles intact and keeps him using them. He might not have as serious of a case as this child, who looks like she can't really use her legs by herself at all. So this children is being helped out quite significantly by the physical therapist. So some physical therapy mechanisms that can be used in anybody, not just children, but children with Tay Sachs as well, is physical exercise. So as we can see here, they want to keep them moving, keep their muscles moving, just stay physical, nothing strenuous. Balance is also very helpful, like I talked about. Ultrasound can be used to keep blood flow going throughout the muscles. So if the muscles aren't being used and they are being damaged too much, this can obviously be very bad for blood flow. So ultrasound and electrical stimulation both keep the blood flowing through their muscles and through their muscle cells. Heat can be used to help with pain. So if the child has not lost complete use of their muscles, heat can be applied to help with pain, and this goes the same for cold. So if the patient has pain in his arms because they are slowly deteriorating or he hasn't been using them much, a cold compress or a hot compress can be applied, and this can help significantly. Okay, so here's going to be all of my partner slides. We'll skip through all those because she already presented them for you. And we will get to, here we go. Okay, and here are all of our sources. So these are all of the sources that we used throughout this presentation. And then here's going to be that crossword puzzle answer key. So she did present hers already to you, and she most likely showed you this already, but I'll show you one more time at the end of mine since she turned hers in before mine, and you can check to see how you did. So we will escape out of this. Okay, and then there was my presentation all about Tay Sachs disease. I hope you walk away, well, you are a doctor, So you probably already know all about this disease and have heard it a million times, but I do hope that I presented it in a way that you understood everything that I was saying, and I hope that maybe you learned something new, because that would be pretty cool if you learned something new. Thank you.